afternoon. How are you doing today?
Good, how are you?
Good. I'm Emily. I'm going to be your PT today. So what we're going to do is, I know you have some lower back pain, is what you were telling me when you came in. So one of the things that we can do to help that back pain and help you help yourself with it is actually strengthen your core muscles. So strengthen all of your abdominals area. When you do that, it helps just stabilize everything so your back isn't working so much to keep you upright. So the way we're going to do this is just a slow progression of exercises. What we're first going to do is I'm just going to have you lay on your back, okay?
All right.
And then just bring your knees up, keep them bent. Okay. So what we're going to do here is I just want you to tilt your pelvis back and forth. Feel like you're pouring water out of your pelvis one way or the other. Okay, and then find a happy medium.
Okay.
Okay, from here, what I want you to do is just tighten across your stomach. You're going to pull your belly button in towards your back. Okay, do you feel like that's tight there? Okay. So here, what I want you to do is, you feel like you're pressing your back into the table a little bit with this position. So I just want you to sort of hold that core in that position through all the exercises. Keep breathing, and if you need to take a break, we just let up, relax, and then bring it back to that position, okay? So what we're going to start with for exercises is pretty simple. So we're just going to have your legs, keep your feet on the table. So I want you to just bring your knees tilted out to the side and bring them back. We're just doing this, sort of moving your body away from the center, and that makes you work your abdominals a little bit more. And then what you can also do is you just stay there, and then bring a knee up, just sort of like you're doing tiny little marches in place. Yeah, switching them in place. There we go. Okay. From there, we can also add on where you're just straightening out your leg from that position. One at a time, bring it back, straighten out the other one. Good. As we keep going, all of these exercises are just going to get a little bit harder. So what we can do from there is then just bring your knee up to about 90 degrees. Good. Okay. And you can do it with the other one as well. Next, we can add in where you're straightening out your leg in that position.
So I go down.
Yeah, you can go down and then bring it back. Yep. And if you ever feel like you're letting up here, we can also add in a blood pressure cuff behind your back, sort of just give you a little bit more visual feedback, not just having to feel whether or not you're keeping your core in that position, okay? So from there, we can also add in a little bit tougher exercises. What these exercises are is I'm going to have you bring one knee up and just sort of hold it up at that bent position with your foot off the table, okay? Then from here, you're going to be doing the work with this leg that's still on the table. So you can tilt it in and out. You can do the little march in place with that. Good. You can do straightening out from that position, lowering down. And you can do it with the other side too. You can switch. Okay? And then we can have them where you're doing both legs at the same time as well. So you bring both legs up, and then straighten out, bring them down. The harder it gets, you can bring them further down. Or is it getting tough now?
Yeah.
Yeah, okay. So from there, we can also move over to where you're on your stomach. This is a little bit harder position because you're not feeling like you're pressing your back into the table as well.
Okay.
We can also add in your arms to help move your center away from your core, okay? So I just want you to just reach out your arm with that core stabilized position. So you tilt your pelvis and pull your belly in towards your back. And then reach out an arm, lift it up, and back down. And the other arm. Okay. You can also kick up a leg here. And you can do opposite arm at the same time, or you can do just the leg as well. Yeah, like that. So here I see that your back is tilting. We can put a little book on here to help you give sort of a little feedback of whether or not you're tilting your back in this position, which is when you're losing that core stabilization.
Right.
From here, we'll also progress you onto where you're on your hands and your knees, face forward, and once again, have you pull your belly in towards your back, keep it sort of straight, tilt your pelvis. Okay, and then we'll place a book on your back or something, a pool noodle, something like that, and sort of just see how it tilts as you're moving. And then we'll do the same exercise. We're lifting an arm, lifting a leg, and since we're not at this level yet, you don't need to be doing that. Okay, and so once we sort of have these exercises down of doing them in these designated positions, then you can start doing that core tightening, pelvic tilt, and just sort of do that as you're doing other exercises, sitting upright, standing, doing your daily activities, okay?
Perfect.
Cool.